Hi, I'm Dr. Chris Welsh, and tonight we're going to talk about inflammation. Simply put, inflammation is your body's protective response to injury or infection. So inflammation you would think is a good thing, right? Not necessarily. Because when we incur an acute injury or a cut, our body sends out helper cells to the site of injury and causes that acute inflammation. But consequently, this is where the healing process of the wound begins. And this process is completely normal and often termed innate immunity. In other words, this is a normal acute inflammatory response, which is what we want. However, when it comes to chronic inflammation, that is not what we want. Chronic inflammation is triggered by an ongoing stimulus in which the immune helper cells try to do the job of healing. However, this constant stimulation creates more cell recruitment, more inflammation, and more unwanted changes in our cells. Subsequently, this repetitive cycle leads to increased inflammation in the body and chronic disease risk. According to the Centers for Disease Control and Prevention, 6 in 10 adults in the United States have chronic disease. 4 in 10 have 2 or more chronic diseases. 7 in 10 deaths worldwide are a result of chronic illnesses with conditions such as heart disease, cancer, diabetes, chronic lung disease, chronic kidney disease, Alzheimer's disease. These are all lifestyle-induced diseases that factors like stress, poor sleep, quality, age of environment, toxins, immune deficiency, and they can all lead to chronic inflammation. But did you know that the foods that we put in our bodies can cause a chronic inflammatory state? Food can either fight or foster inflammation. Research shows that food choices that we make heavily impact whether or not your body reverts into an inflammatory response. So how do we know which foods are going to cause inflammation and which ones are going to help us fight inflammation? Because there's so much contradictory information out there. So this is where we're going to turn to evidence-based research. One way we measure inflammation is through C-reactive protein markers. This is a marker for inflammation found in our blood. Research consistently shows that the following ingredients contribute to increased levels of inflammation in our bodies. Number 1, high fructose corn syrup and sugar. Number 2, vegetables and seed oils. Number 3, refined carbohydrates. Number 4, processed meats. And number 5, trans fats. Now that we've defined what inflammation is and discussed the factors that contribute to inflammation, here are 10 powerful foods that you can incorporate into your diet to fight inflammation. Number 1, avocados. Avocados are sought after for their creamy texture and satiating taste, but these powerhouses, when it comes to fighting inflammation, are unmatched. Avocados contain a significant amount of heart-healthy, unsaturated fats, antioxidants, fiber, potassium, and B vitamins. Vitamins C and E are 2 of the antioxidants found in avocados that promote heart health by slowing the rate of LDL, or bad cholesterol. And additionally, research shows that avocados' potassium and lutein content may help promote normal blood pressure and help control oxidative and inflammatory stress. Here are a few great ways that you can add an avocado into your diet. Use an avocado as a spread instead of mayonnaise on your sandwich. Create a delicious guacamole dip for crackers or veggie sticks. Add sliced avocado or a healthy egg to an omelet and scramble it. Enjoy a decadent avocado mousse dessert. The second one, the most antioxidant, is going to be beets. Beets have a naturally occurring pigment called betaine, which gives them their brilliant red color. Beetroot and beetroot juice were both found effective in preventing blood pressure and inflammation. Certainly, this makes them high anti-inflammatory foods. Additionally, beets may improve joint discomfort associated with osteoarthritis. Now, here's a beet tip. Due to the fact that betaine concentrates is diminished when it's exposed to heat, just lightly steam your beets for about 15 minutes to get the most anti-inflammatory benefits. Number 3, berries. Berries like blueberries, blackberries, raspberries are all rich in anthocyanins. This is a phytochemical that helps their berries keep their deep purple, blue, and violet pigments. Further, they reduce inflammation through inhibiting nuclear factor kappa B activating, increasing the rate of the PPARY gene. In 2019, the Clinical Journal of Nutrition showed that eating 1 cup of blueberries daily reduces your risk of cardiovascular disease by 15%. Additionally, other benefits associated with berry consumption include reduction in cancer risk, cognitive decline, dementia, heart disease, blood cholesterol. Berries, including fresh and frozen, into your diet intake and maximize your intake. Purchase produce and seasonal and optimal nutritional value. Wash your berries right before you use them. That way they won't go bad. Number 4, green tea. Green tea contains antioxidant compounds called catechins, and they are the most active component. They're called EGCG, and it reduces inflammation by producing pro-inflammatory cytokines. And green tea is one of the best things that you could be drinking other than water. Brew your green tea at like a lower temperature and do it for only about 4 minutes, and then steep the tea for about 5 minutes to produce that so it doesn't have that like unwanted bitter taste. If you want to add even more antioxidants to it, add a little matcha powder. Matcha powder is created by grinding green tea leaves into powder, and the consumption of the entire leaf itself results in more potent effects, consequently making this powerhouse anti-inflammatory food a top for you. Number 5, as Rachel would say, EVOO. Olive oil is rich in monosaturated fat oleic acids, the anti-inflammatory antioxidant anilicolinol, vitamins E and K, and certainly they make an excellent anti-inflammatory food. Research suggests that oleic acid found in olive oil was inversely associated with inflammation markers such as your CRP, that C-reactive protein. Likewise, other anti-inflammatory responses are similar to that of ibuprofen. The Mediterranean diet, characterized by the consumption of olive oil, is associated with reduction of that CRP and overall inflammation. So when you're choosing an olive oil, be sure to opt for EVOO, or cold-pressed olive oil. Extra virgin olive oil is the least processed and tastes the best. But most importantly, it's got the highest amount of antioxidants, vitamins, and polyphenols. Number 6, onions. A staple vegetable consumed worldwide, onions are packed with anti-inflammatory properties. Onions contain an anti-inflammatory flavonoid called quercetin. According to the Arthritis Foundation, quercetin reduces inflammation, and it does this, for instance, by inhibiting inflammation-causing leukotrienes, prostaglandins, and histamines in osteoarthritis and in rheumatoid arthritis. It reduces the effect of heart disease, lowering LDLs, or bad cholesterol again, and helping prevent the progression of cancer. So, onion tip. When cooking with red onions, aim to remove as little of the outer layers as possible to best retain that quercetin complex and those antioxidants. Number 7, spinach. Spinach is rich in anti-inflammatory antioxidants. Lutein. A 2017 study published in the Atherosclerosis found that lutein decreased chronic inflammation found in coronary artery disease patients by decreasing the pro-inflammatory cytokine interleukin-6. Further, a 2018 study found that the bioavailability of lutein was affected by temperature and heating times. Specifically, they found that cooking spinach at higher temperatures decreases the lutein. So my spinach tip for you is that lutein is a fat-soluble antioxidant. So in order to get the most health from that spinach and increase the bioavailability, be sure to pair spinach with a healthy fat. For example, olive oil and a whole egg. Number 8, turmeric and black pepper. Turmeric is all the rage right now and is commonly referred to as the golden spice. Moreover, it's known for its anti-inflammatory, antioxidant, and anti-carcinogenic properties. The main ingredient found in turmeric that gives it its anti-inflammatory effect is called curcumin. Studies show that curcumin can aid in fighting chronic inflammation in the body and suppressing inflammation in molecules and subsequently reducing osteoarthritis, general pain, depression symptoms. But curcumin is not paired and absorbed without black pepper. And that black pepper bioactive ingredient is called piperine, and it increases curcumin absorption by 2,000%. All right, number 9, walnuts. The omega-3 fatty acid, lanolinic acid. Consequently, this promotes heart health through reducing artery-blocking cholesterol. Overall, ALA is particularly beneficial for cardiovascular disease. And here's some great ways to add nuts to your diet, walnuts specifically. Add chopped walnuts to a green salad. Toss a small handful of nuts in a Ziploc bag and enjoy them as an on-the-go snack. Serve walnuts on top of yogurt or oatmeal for a delicious crunch. You can add walnuts to homemade granola. You can use crushed walnuts as a coating for chicken or for fish. And last but not least, number 10, wild caught salmon. It's an excellent source of protein, of vitamin D, vitamin B12, omega-3 fatty acids like EPA and DHA. And those omega-3 fatty acids decrease the C-reactive proteins that we were talking about before. They decrease the concentrations of pro-inflammatory cytokines and the synthesis of triglycerides, which contributes to high cardiovascular disease risk. So, the American Heart Association is recommending at least 2 servings of fatty fish per week. For example, that would be like 3.5 ounces of cooked or 3/4 of a cup of flaked fish. The anti-inflammatory action diet plan that I love my patients to use is something that is not going to make you healthy or unhealthy. It's just that no single food or ingredient is going to make you healthy or unhealthy. It's about the way your entire diet and the foods you choose to consume on a consistent and regular basis are ultimately going to determine your overall state of health. I'm not sure if it's completely overwhelming for most people, so I'd like to give you a couple of quick ways. Number 1, introduce inflammatory foods into your regular diet. Aim for meals composed of predominantly plants, for instance, with 3/4 of your plate coming from vegetables and 1/4 of your plate coming from animal sources. Number 3, include some wide variety of plant colors in your food. I like to say eat the rainbow of colors. Like the more colors you can get, the better. Number 4, fresh and whole foods that are full of nutritional value and packed with antioxidants are way better than dead and devitalized foods. Reduce your intake of processed foods and drinks containing any kind of artificial sweeteners or things like that. I mean, I ended up doing this talk today because I had a long conversation with a patient who's been here for a really long time. And she was explaining to me how overwhelming it was to try to figure out what to eat. And, you know, it just gets so overwhelming, you just kind of give up. So I'm hoping that tonight, a couple of these tips, I mean, no, not everybody's going to love beets and avocados and walnuts and salmon, but maybe you can start one day a week. Maybe try to incorporate a few of these foods a little bit at a time and allow your body the opportunity to change the way your taste buds are. because honestly, your body has been trained to enjoy junk food. Your body has been studied by science to figure out how to get you to eat these devitalized foods. And what we need to do is get back to nature, get back to eating whole foods, meats, vegetables, cheeses, those sorts of things. So I'm hopeful that this was helpful for you tonight. I know this is a lot longer than we usually talk, but we are going to post this on our YouTube page, and it'll be on all of our reels for the first 10 minutes, because that's what Instagram and Facebook will allow us to do. So I love you guys. I appreciate you guys. And I'm so proud of you for wanting to think, to feel, and to do differently. Good night. I'm Dr. Chris Welsh from Eaton Chiropractic, and I'll see you next week.